to discuss this new development, we have Ranjit Rye, Professor Ranjit Rye of the OCTA Research Group, who's now joining us over the phone. Good afternoon, Professor. First off, with the detection of these 97 new Delta cases in the country, how likely is it that there's a community transmission of this more infectious variant?
Well, we can only guess, no? It's likely that there will be community transmission already. We're seeing already from the side of OCTA a surge in COVID-19 cases. I think the important thing now is to remind our public to be, to be careful, to be vigilant, to always practice with discipline our minimum public health standards, because this is a highly communicable variant of COVID. And as OCTA has already suggested, we need to all work together to ensure that this surge in cases will not accelerate.
Right. Professor, I understand that NCR mayors are pushing to speed up the vaccination during the proposed 2-week lockdown across the region. Do you think this will be effective?
Well, yes, of course. The vaccination is the responsibility of the local government unit, and many of the workers doing the vaccination, who are part of the vaccination process, are also healthcare workers at the barangay level. And when there are surges, they're called back to man quarantine facilities or isolation facilities. They're also called back to duty to do other work to deal with the surge. So the surge complicates a lot of things, and we hope that the government takes precautionary measures now, while it's early, so that we are able to contain or even reverse this surge.
Professor, one of the reasons given as to why there is not a stricter quarantine status right now in this region is that the situation in the hospital is still relatively manageable. Do you agree with this? And how long do you think this can last?
Well, we don't disagree with that assessment of the DOH. But what we are stating is that there is a surge already, and that we hope that the government will not wait for cases to explode or for hospitals to fill up before we act with precaution, preemptive measures, to reduce the number of cases or break the chains of transmission. We have made our suggestions already to government, and we've ventilated it to the media. We've submitted our studies, and we leave it up to government to decide, and we will respect government's decision, whatever it is. But that being said, dealing with a surge possibly driven by Delta is going to be a tall and a very, very serious challenge. And it will require all of us to work together with government, with our local governments in particular. The private sector will need to pitch in. And we will have to do our part. We need to do our part as fellow citizens in this collective fight to prevent this surge of cases in the NCR from further accelerating.
Right, Professor, under the current circumstances, how do you think, in your opinion, how do we prevent a surge similar to that in India or Indonesia due to the COVID cases driven by the Delta variant?
OCTA has already suggested that a 2-week, a strategy of go early, go hard, and we feel that right now, despite its unpopularity and its real impact on the lives of everyday Filipinos, that we might need to do a surge. And we're suggesting, what we might need to do a lockdown to prevent the surge from accelerating. We are suggesting we do the lockdown early this time, learning from the lessons of the last surge in March, which was catastrophic for us in the national capital region. We hope that we won't need to wait for cases to go up and for hospitals to fill up before we do a circuit breaker lockdown. And we're suggesting we do it now while cases are low. And at the same time, we also accelerate the vaccination process while we're doing this. The lockdown will be augmented not just by testing, tracing, and isolation, but also by, the government would have to conceptualize or contemplate providing social amelioration for the people who are going to be affected by this. So this is a painful pill to take, but I think if we do it early, our lockdowns will likely to be shorter, and the cost, of the whole intervention will be less in terms of lives and livelihoods.
All right, thank you for your time and usual insight. That was Professor Ranjit Rye joining us over the phone.